Well, again, good afternoon to everybody who's joining. I think we'll just give folks another minute or two. I know that sessions kind of run right up against one another. So, and if you do have the ability, again, I'm not sure whether they've got everybody kind of on mute, but if you do have the ability to answer back, please feel free to do that. And also know that throughout the presentation, if you have any questions, I'd be more than happy to answer your questions as we go along. All right. Well, I think we'll go ahead and get going. Again, thank you for joining me for the presentation. My name is Paul Wright with Isafe, and today what we're going to do is talk about device screen time and blue light and the impact on our health and productivity. And I'm going to cover a number of different topics. We're going to certainly talk about screen time and blue light. We're going to talk about some of the impacts and share some research with you. Also, some survey results that we've got over the last few years. And like I said, I'm not sure, my first time working with the Tennessee group, and I'm not sure in this setting whether you're able to ask questions or whether you're all muted. But if you do have the ability to ask questions, please. Otherwise, we'll get rolling here. And like I said, look forward to sharing some time with you. By the way, Isafe, our partner Trafera, you may be familiar with Trafera. They are our education channel reseller partner. We just formed that relationship this year and are really excited to be partnered with them. I know that they sell product all across the United States, and like I said, I'm sure some of you are certainly familiar with the Trafera folks. But a great partner of ours, and thrilled to have them on board with us. So, just to kind of jump into the topic, uh, I'm not sure how familiar folks are with the topic of screen time and blue light. So I'm just really going to kind of do a level set and just get like not only some background on screen time and what actually is blue light, but also just kind of share some findings and then also share some feedback from some of the doctors that we work very, very closely with. You can see this statement. Dr. Sherry Rowan, based in California, is really a world recognized ophthalmologist and is one of the leaders in blue light research. She's also a member of our Vision Health Advisory Board. Like I said, almost everything that we do is very driven. The messaging, the products that we put out, best practices, all of that is very, very driven by the medical community, our Vision Health Advisory Board, and frankly, doctors all over the globe. So just to kind of explain blue light, what blue light is it's a very measurable thing. It's actually in all digital devices emit blue light, whether it's a smartphone, a tablet, Chromebook, laptop, monitor, all of them emit blue light. And as you can see kind of on this chart, the area really of primary concern is 400 to 500 nanometers. But if you want to be more specific, where the growing concern is what we call kind of a toxic blue light or peak blue light. And if you look at the charts, if you see an LED and OLED here, the reason that so many of these devices now have these just beautiful colors and images and luminance, it's a double-edged sword. Yes, gorgeous pictures, but it does come with a bit of a cost, because as we push those boundaries and create these, wonderful devices with amazing color gamut and luminance, we're also pushing that blue light to peak levels. And the primary area of concern, especially over the last couple of years, we're beginning to kind of learn that 435 to 440 nanometers is really of concern, especially over time, but also as it relates to kids. And we'll kind of explain why that's the case as we move forward. So, who are we? Who is Isafe? Isafe is actually our company. Was formed about 7 years ago, actually before blue light was really much of a topic. We had a few doctors that were seeing signs of people's vision changing. They were seeing habits of cognitive behaviors changing, and they really linked it to our ongoing use of digital devices, in particular, the growth in the smartphone market, the tablet and Chromebook market. They started to really see some changes. And so we went out, did a tremendous amount of research, worked very closely with the medical community, and launched Isafe. At the time, it was a company actually called Healthy. We switched to Isafe about 3 or 4 years ago. And where we started is really, again, not only with research, but also trying to build kind of a global awareness around the topic. As you can imagine, 5, 6 years ago, when we brought up blue light, it really didn't resonate. People really didn't understand the impact of blue light. However, not only has it changed in the last 3 or 4 years, it's changed dramatically during COVID, as you can imagine, with the increased device usage. So where we started to make some impact 3 or 4 years ago, you can kind of see some of the partners that we work with. Actually, Dell was the first group to say, we want to address blue light. We've got these beautiful devices, but blue light, is of concern. We do want to begin to address that. And so when you see that middle image there of in display, we actually have some standards that we put together with a third-party certifier called TUV Rhineland to address or just kind of set a basic guideline as to what sort of impact we should have on the LEDs within a device to make it a tad bit safer than devices of the past. So we started in display. You can see on the bottom line there are groups like Lenovo, Acer, BOE. Those are all OEM manufacturers and or ODMs where they're actual display makers. And over the last years, like I said, there's various levels of adoption, but we've partnered with each of those groups in some manner to begin to create what we call Isafe displays. The other part of the business that just really kind of blossomed within the last 1.5 to 2 years is our screen filter business. So we have an Isafe screen filter that goes on virtually any device. It's device agnostic, but it's CAD designed to your particular device. So you can get a blue light filter for anything from an iPhone or a Galaxy phone to tablet, Chromebook, laptop, and monitor. And that actual screen filter, of course, is an aftermarket hybrid film that you actually apply to the actual device itself. And then the other area is augmented reality and virtual reality is actually an area that is just starting to take off. But as you can imagine, putting a device 1 inch from your eyes and wearing that in kind of an augmented reality setting is of concern, because we've gone from sitting in front of cathode ray TVs, 15, 20 years ago, to putting devices 14 and 10 inches from our face now. And AR and VR will bring devices even closer, 1 inch to 1.5 inches away from the eyes. So that's something we're beginning to address now. Another, significant shift in the entire screen time and blue light conversation is United Healthcare, who you see noted here, about 2.5 years ago reached out to us and said, we're beginning to get more and more questions through our vision health plans and other areas about the impacts of screen time and blue light. We would really like to take more of a position and build some sort of an educational platform around exactly what is blue light, what is this doing to our eyes, in particular kids, like I said, that are more vulnerable. And we formed a formal partnership with them just within the last 18 months that is largely based on sharing the messaging around screen time and blue light. United Healthcare has a couple of very, very large competitors that some of you might be familiar with, may even have vision insurance through them. VSP is the #1 worldwide provider of vision insurance, and IMED is #2, with United Healthcare being third. And now all of them have taken some sort of a position on blue light. Allianz is another group globally that's taking a position and looking to inform their members. So a lot of interesting developments, a lot of momentum, a lot of groups saying we need more research, we need to learn more about blue light. I'm going to pause just for a second. Again, I think you're probably all on mute, but just in case there are any questions initially, I'm going to just pause for about 10 seconds and just see if anyone has anything that they want to ask at this point. All right, very good. So just to kind of cover, screen use and where things are trending, it's no news to any of you, obviously, with the changes in remote work and distance learning, and I'm sure all of you, the way that you went about your daily business changed significantly somewhere around February or March of last year, and probably remains, significantly changed to this date, and may even be you may be experiencing big changes going into the fall here for as you get ready to go back to school. And that's not unique. Obviously, everyone around the globe, this COVID was a very trying time, but we saw amongst a number of challenges, we saw device time, our time on devices absolutely explode. And so here's just a few stats. Probably not surprising that 4 out of every 5 American adults spend a minimum of 2 hours a day on a device. That number has gone up dramatically over the last 5 years. The number of American adults that experience eye symptoms, some sort of digital eye strain, and that would fall into the categories of dry eye, itchy eye, even things like headaches. Those numbers have gone from virtually nothing 10, 12 years ago to, and this is a 59% in this survey. There are surveys that have that number upwards of 80%. But I guess the real point is that the majority of us who are on these screens do experience some sort of digital eye strain. And the other statistic that during COVID was frankly a bit alarming was, out of the adults that were surveyed, we did a few different surveys. We saw device time had really exploded to, on one of the surveys, over 10 hours a day. And in the case of teenagers, device time had gone to over 13 hours a day, which is frankly crazy if you think about it. But just given the fact, again, with remote work and distance learning, you add to that our spare time when we're streaming programs and kids are on Fortnite or playing some sort of a game. Almost every one of our waking hours we're spending in front of a device. So here is some data again that I've got a couple just highlighted for you that really show the dramatic increase in our usage patterns particularly over the last 18 months. However, COVID is not the only reason for this. COVID, certainly, put a little more gas on the fire when it comes to device usage. But really, this trend had been in place for the last probably five to 7 years plus. But during COVID, what we did see, and like I said, you can see some of the data here, surge in computer use and a few others. But I pointed out the rise in streaming platforms to 200% rise in that, and growth in video chat time, 350%. Not only because, again, those increases are so dramatic, but it just goes right to the fact that, once again, that's us spending time in front of a device where typically in a video chat setting, we have that device anywhere between 8 and 20 inches from our face. So that screen time and that blue light exposure and peak blue light exposure is even more dramatic. So I kind of mentioned the relationship with United Healthcare, and what they wanted to do right out of the gate is to do a survey across a number of different areas. And so the very first survey that we did, and this is a summary of that survey, which wrapped up in July of last year, we did a pretty basic, screen time survey to just get a feel for what people were thinking and usage patterns. And it was very interesting because it was actually over 650 people responded, and it was a combination of eye doctors, optometrists, and ophthalmologists, and then also folks who work in HR and tech within companies that were small to mid-sized businesses and all the way up through the Fortune 100. And we saw some pretty amazing results, but the one, again, that was very profound was the eye doctors that were surveyed, and there was just under 200 of them that responded. 19 out of 20 of them were concerned about screen time and peak blue light, just because of the changes that they had seen in patient patterns over the last several years. And really, frankly, and I don't want to put words in their mouth, but the reality is that the blue light conversation is still fairly fresh and new in the grand scheme of things. And we really lack a lot of long-term studies and a lot of concrete data. That stuff is being worked on, but their concern is, frankly, that they're seeing patients where there's a difference in their vision, there's a difference in some of the cognitive patterns, and they associate it not exclusively to screen time and blue light, but that's certainly a contributor. And you can see some of the other areas here where people have been impacted. The one area that is really irrefutable is the circadian rhythm, just sleep patterns, that blue light really has an impact. And we're going to talk a little bit about that here in the next few slides. We're going to dig into that, not only as how the circadian rhythm impacts adults, but also kids. But if you see some of the areas where there was concern, certainly, like I said, mood was another one. The surveys that we do, anywhere from about 40 to 70% of doctors surveyed say that they're concerned about the blue light impact on both adult and kids' moods. So just to kind of give you a glimpse, not only here in the United States, but globally as to, what's being done about this. Like I said, in the grand scheme of things, the conversation around screen time and blue light is really kind of cutting edge. However, we are seeing over in Europe and a few other areas, Europe and Asia in particular, they are keenly aware of blue light, and frankly are out a little bit ahead of us. However, the state of California back in 2019 put together really took a stand on blue light. And what they did is they passed a blue light resolution that's noted here. It actually brings awareness to the topic of blue light, and it actually asks people to consider taking protective safety measures in reducing exposure to high energy visible blue light. So very, very, very important move by the state of California. As many of you know, they a lot of times will lead on health-based topics. They were a leader in the 5-star energy movement back 20 years ago. And in doing so, they actually recognized the day. The state of California recognized October 10th as Blue Light Awareness Day. And so again, just saying, listen, if you own multiple devices and you're spending a lot of time on those devices, as many of us are, they're just saying, take precautions, do what you can to, be more aware of your blue light exposure and learn more on the topic. As I kind of noted, you see some of these actions all over the globe. Most recently, actually just 2 months ago, the country of France passed legislation that they're now removing LEDs as soon as 2022 from all kids' toys. And I think it's a great move, frankly, because years ago, and I'm an older guy, as you can see me on the screen. I'm an older guy. I didn't grow up with a blue light emitting toy in front of me when I suppose this youngster's not even 2. But the device usage by kids who are 2 and 3 and 4 years old before they ever even enter, a K through 12, is really kind of alarming. You often see 3 and 4-year-old kids in front of, a tablet of some sort. And like I said, France, another leader, on the forefront of this type of thing, has decided to, kind of take the move into their own hands and eliminate LEDs by 2022. And I think, again, I share both of these things, California's position, and they're looking at doing more legislation and being more active in, what kind of language might even be in quotes, proposals for hardware and that sort of thing. Those are all things that are being looked at by governments all over the globe. And so I wanted to at least give you a couple of snippets of things that are going on. And again, I'm going to pause just for a second. Again, not sure whether everyone's on mute, but if you have any questions, I'm happy to answer them. And again, I'll just do a quick 10-second pause. All right. So what's going on? And again, in this presentation, we're going to touch a little bit on the adults. We're going to touch a little bit on, how it impacts kids. So this during our screen time report, one thing that was really interesting is we actually had 93% of parents that were surveyed were very concerned to somewhat concerned about the impact of device screen time on their kids' eyes. And again, you don't typically in surveys see 93 or 94 or 97% on anything, but it just does point to the fact that there are some very, and I don't want to call them troubling trends, but I think that the topic of screen time and blue light is certainly one that people are looking to learn far more about. And with parents, with the move to distance learning and certainly the move to that remote work setting, there's more and more parents looking for answers. And so why are kids particularly at risk? And this is, you folks all, are in a setting where you're working and with kids on a daily basis. Kids are just far more at risk with peak blue light, and it's for a number of reasons, but a few of them are highlighted here. You can kind of see the image in the lower left that kids just inherently like to look at a device on average about 8 to 10 inches from their face. It's not unusual at all. I've got a 13-year-old to see my daughter, laying in bed at night, on her stomach with the phone right in front of her. The device is probably no more than 6 or 7 inches from her face, and she's, FaceTiming with friends, and she's on Twitter and whatever she's doing. That's a fairly typical thing. And why this is really kind of potentially troubling is you see the second bullet there, the inverse square law. Half the distance means 4 times the energy. And so as a child holds that device close to their eyes, not only do you have more of that peak blue light that's kind of making its way through the retina and potentially causing damage long term, but a child's eye, whether a child is, 7 years old, 9, 12 years old, they lack that natural protection that a lot of us, most of us adults have. Over time, we actually have a natural clouding of the eye that takes place that provides at least some level of protection against peak blue light. Kids lack that protection. You don't have that protection in place until you're in your very late teens or early 20s. Again, it can depend a little bit on the individual. So there are a number of factors that really mean that kids are much higher at risk. The last bullet I've always found to be very interesting, and that is at 400 nanometers, and that's beginning to just get into that visible blue light spectrum, a child's retina is exposed to between 4 and 10 times more blue light than an adult's retina. And again, the wide range there, the 4 to 10 times, there's a number of factors there, but everyone's eyes are different. Everyone's ability to withstand some of the screen time and blue light is different. It's not unlike the sun, frankly, where some people just can take more of the sun more naturally, can tan. Other people, the sun, if they don't have SPF 50 on, can be a significant issue. The only difference here is that blue light truly is an issue for all of us and screen time. So worth noting. Just a few other things as far as the kids are concerned. Obviously, kids are visual learners. 80% of what they learn, they're learning directly through their eyes. And so, and these stats, by the way, all of these, if you look at the presentation after, we've got citations as noted on the intro slide. We leverage the medical community in a very significant way. So most of the citations you see are from groups like Prevent Blindness, the AOA, which is the American Optometry Association, Cedars Aspen. So all of these statistics that you're seeing are from these tremendous partnerships that we have in place. Also, 65% of all people are visual learners. So 2/3 of us, again, really relying heavily for every bit of learning we do taking place through our eyes. And the other kind of thing that compounds things here is that 1 out of every 4 children are affected by a vision problem going into all of this. So whether they've got some sort of myopia or some sort of stigmatism, some issue that they've already got in place, any kind of screen time in blue light, like I said, is a bit of a compounding factor for 25% of the kids out there. So we're going to talk a little bit about like some of the ways that screen time and blue light impact, all of us. And if you see at the top of this chart, the release of melatonin, it was interesting because as blue light research really started to pick up 5 or 6 years ago, the one area that most research landed on and said, this is factual. We see a decrease in the release of melatonin, which means there is a disruption in sleep pattern or circadian rhythm, and that is in part attributed to blue light and that screen time, particularly within 2 hours of going to bed. And even companies that, if you think back to the slide I shared earlier, all the different panel makers and OEMs that we work with, even a company like Apple recognized this and created, many of you who have an iPhone know that they've got a software adjustment called Night Shift. And really what Night Shift is really just kind of killing a mosquito with a sledgehammer. It is really down, putting or lowering the level of luminance in the phone, lowering those blues, but it also comes with a pretty significant sacrifice to your color gamut and the look on your screen. But everyone, most of the device manufacturers are making moves to address that in one way or another. So, how does it disrupt sleep? And so, again, different for adults than for kids. Yes, it absolutely disrupts the sleep of an adult, which we all know what, going to work the next day, whether you're, because you didn't get as much sleep, you're a little more cranky, you're obviously a tad fatigued at times. There's a number of things that go with that disrupted sleep pattern. But as you can see here, we've got kind of essentially a little model on what's exactly happening. And because that blue light, the peak blue light in particular of 415 to 455 nanometers, goes right back through the retina, it's really sending some signals to your brain that get in the way of the melatonin, the release of melatonin. And so it's sending that false signal, kind of a trigger that suppresses the melatonin and therefore causes it, well, really either a delay in your ability to get sleep or disruptions throughout the night, especially the first part of the night, in being able to get into that deep REM sleep. And again, this is for adults certainly of concern, but if you think about kids, it is of more. It's more of a concern for a number of reasons, because they're linking some of that disruption in circadian rhythm now to behavioral issues, depression, reduced performance, and that, needless to say, is alarming, simply because they're going to have a longer life in front of any and all devices than we will. Again, I'm a 50-plus-year-old man. I wasn't exposed to devices when I was 3 and 5 and 7 years old. But as you see from this image, kids in front of devices now and those disruptions in sleep pattern, that's something that's going to be with this young person here for the next 70, 80 years. So again, just something to certainly be aware of. We've also kind of talked about kind of where the blue light trend is going. There are, right now there's research ongoing, a tremendous amount of research ongoing. And because we are on the cutting edge of this, a lot of that research is kind of to be determined. It's TBD. However, it's interesting to note that about 7 years ago, there was essentially no searches on blue light and the impacts of blue light. And right now, that number is north of 3,000 searches every single week that are taking place on blue light just here in the U.S. alone. It's kind of crazy how things have changed in the last 5 or 6 years. And during COVID, the research and people looking for answers has actually exploded. But we've got groups like Salus University and many others. There's actually global universities located in Italy and France that are doing research. And it's interesting because over the next 2 to 3 years, we're going to have a lot more data on exactly what screen time and blue light is doing to each and every one of us, based on the amount of hours we spend in front of a device, our age, and preconditions like vision problems, myopia, and that sort of thing. So just some things to look out for. Again, I know that this group works very closely, obviously, with kids. There are some things that you can see, that you can witness, that can kind of let you know that a child is maybe having some issues with a digital eye syndrome. And some of those that you can see pretty easily are complaints of headaches during or after schoolwork. Rubbing of the eyes, that's one that you can see quite often, because we do get a drying of the eye that happens for most of us when we're on a screen for extended periods of time. Losing place while they're reading can be another thing. Now, that doesn't necessarily mean, obviously, that it's related to just screen time and blue light, but these are more like just vision issues in general. However, screen time and blue light is can be a contributor to all of these. Squinting, some sort of sensitivity. The other thing too is you'll see them move the device closer or farther away from their eyes, kind of doing a readjustment. So these are just things to look out for, and just signs that there may be some sort of a vision issue worth having the child and parents look into. So there are other studies right now that are ongoing about just the long-term implications of what screen time and what peak blue light will mean for all of us down the road. Again, needless to say, LEDs, OLEDs are, in the grand scheme of things, a fairly recent technology that's been developed. Just our smartphone use and digital device use has exploded just within the last 12 to 13 years, and more so over the last 7 to 8 years. And so long-term implications as to what's exactly happening to us, to the retina, and to our photoreceptor cells, that's going to be ongoing, because really you need to look at this for 15, 20 years to really understand. But that research is ongoing with a number of different institutions around the globe currently. And again, I think if you go back to the research that we've done in the survey we did with United Healthcare, where 19 of 20 of those eye doctors surveyed said that they're concerned about blue light, I think that's pretty telling as to where the trend is. So again, I know obviously this is a group, like I said, works a lot with kids. However, this is a group that's on our digital devices too. I mean, whether you're admin or whether you're in some sort of an IT capacity, you're in front of a device a ton. All of you are. There's no doubt about that. And even during our leisure time. So just some things to kind of keep in mind, that if you're experiencing any of these symptoms, that and again, 65% of all adults do experience these symptoms, to just be aware. And the common symptoms are tired eyes, watery or dry eyes. It's typically one extreme or the other. Most folks will have more of a dry eye. However, some people, your eyes will actually produce more tears, because they're going through the fire alarm, for lack of a better way of putting it, is going off, and your eyes will produce more tears to try and protect. And so blurred vision is another one. Headaches is a very common one. If you were to say, what do we hear the most? I would say it's dry eyes and headaches are something we hear a lot of. And then sore neck, shoulder, and back, obviously, because so often we're looking down. We don't have that monitor or laptop set up at an appropriate level. And now, because our device time is exploding, we're kind of doing that kink in the neck, and we're bent over. And so those are some of the things that you do experience. One of the other areas, and again, I highlight productivity because it is an area of concern. To me, it's certainly secondary, obviously, to more of the health or the safety part of this, and the impact on your eyes. However, productivity is important to all of us, and whether it's in the work setting, or whether it's your ability to be on top of things in your home life, productivity is obviously key. And again, so much of this goes back to circadian rhythm. If we get a quality night's sleep, and we've been in REM sleep, and we haven't had that circadian rhythm interrupted, we're just far better in all aspects of life, including obviously productivity. So just something to kind of look out for. There's the general guidance from your eye doctor, if you ask them across the board, will be to simply not be in front of a device for a minimum of 2 hours before you go to sleep at night. However, again, sometimes that isn't possible. Sometimes we've got a meeting that runs late. Sometimes we're watching some show, streaming a show with our family, whatever it might be. You're not always going to hit that effect, or 2 hours of downtime prior to going to sleep every single night. And in that case, it's definitely a good idea to look at some sort of filtering product, and not have to turn on software. Probably a good option. So here's some just tips for you that you can really walk away today with these, and you can employ them right out of the gate here. And these are from, like I said, from our Vision Health Advisory Board, from our doctor community. And really what they're saying is, improve that learning space or that working space if at all possible. Keep the device, if you can, 30 inches away from the eyes and 15 to 20 degrees below eye level. Again, this is not always possible, but if you can change one of your workstations, if you've got a workspace at work or at school, and then you go home, you've got a different workspace. If you can even change one of them to be a little more ideal, that's wonderful. It's gonna help you in a big way. Also, adjusting the room lighting. Adjusting the room lighting is really important as some sort of anti-glare setting, if at all possible. And then considering displays with blue light protection. The doctors a lot of times will say, a display is a great way to go simply because blue light filtration on the display is 100% hit rate. Whereas, with kids, if you have blue light glasses, they get broken. The compliance isn't great. A lot of kids don't like to wear glasses. They lose them. Whereas some sort of blue light protection on the actual device at the source means 100% compliance. Some other things here that are really helpful. Take a break every 15 minutes, or excuse me, take a break for about 15 minutes every 2 hours. Again, if you have teenagers, you know that this might be a tough sell. I've got teenagers. The idea of just set that device down for 15 minutes every 2 hours, take a break, may or may not fly. If you explain to them why, for health and safety reasons, you might have a little better success. But the second bullet here is a good one because it's easy, and that is the 20-20-20 rule. So every 20 minutes, take 20 seconds and look at something 20 feet away. And the reason for this is that you will reset your eyes. And that is, if you talk to your, optometrist, ophthalmologist, they'll tell you that this is one of the most important things that you can do, because as we sit and we stare at that device all day long, and it's 10 inches from our eyes, things like age-related macular degeneration and myopia are far more likely if you train your eye to just be looking at something for hours and hours at a time that's 12 or 14 inches away. You're training your eye to do the wrong thing. So 20-20-20 rule is really important. And consult an eye doctor. As much as I enjoy kind of sharing this information with you here today, I am certainly not an eye doctor. It's really important to get in front of an eye doctor, ask questions, ask about screen time and blue light, talk to them about your device usage, and get a real plan put together with your doctor. That is really, really critical. I'm not going to get too much into what we do, but I kind of mentioned, we have a patented screen filter family. You see some of the things that went into the building of this screen filter family. This is what Trafera, our partner, sells into the education channel, largely, obviously, for Chromebooks, but literally we're device agnostic. So these covers can go on anything from smartphones, iPads, Chromebooks, laptops, monitors, you name it. And if you look at this, I think the most important reason I wanted to share this is this was a product that was really designed very, very closely with the medical community. And so if you look at a lot of the standards that are put in place here, we've actually got a retina protection factor that we trademarked years ago. So we follow a very close guideline as to exactly what levels of blue light and peak blue light we should be blocking. We weight that protection towards the areas of most concern, which is 415 to 455 nanometers. And what's also nice is, and again, less important than the safety part of this, however, still important, is that our product, our secret sauce, we have 24 patents that are either owned or licensed around the globe. And our secret sauce, if you will, is the ability to manage that blue light and peak blue light in particular, but to do so without a cost to your color gamut and luminance, that user experience. You can see protection out there that's got a yellow tinge or a green or kind of a champagne color. Those, frankly, are either not effective or cause such damage to your user experience that folks a lot of times will just peel them off and say, I'm not gonna roll with this. So here's just an example of a little bit about our technology. If you look at other solutions, and other solutions, frankly, is anything from dimmers, things like Apple Night Shift and others, where they're taking that software that you can kind of turn on, that really kind of dims down the luminance and the color gamut on the product itself, those high blues. We're able to actually manage the blues, the picture on the right there, and do so with, frankly, very little, if any, impact to color gamut and luminance. And again, I share that with you because this is far more about the health and safety and productivity part of it. However, if you can protect yourself with a solution that doesn't cost that user experience, well, that's ideal, and that is certainly where we kind of live. And here's just the product family itself. And again, I'm not going to spend a lot of time here, but just I'd like to share some of the differentiation that we have. And that's simply the fact that these are all patented screen filters. They truly are best in class. They're designed with the medical community. And one thing that's neat is, like I said, the other ways of addressing blue light, typically it's some sort of glasses product. This is protection at the source. So you're not gonna break it or lose it like glasses, and you're assured that, especially with kids who aren't great at holding on to anything, that once that protection is put on the device, that you're covered. So just a look, and we're close to wrapping it up here, and I'm going to be able to give you a little bit of time back because I know that you're heading toward the end of your day here. A lot of these behavior shifts are going to endure. I think we all know that. Now, might there be adjustments to some remote work and distance learning? Certainly, and I hope we do get kids back to the classroom. However, some of this is here to stay. You know, that option of distance learning obviously was something that it was required. It was, you know, across our entire country and the globe for that matter. But the convenience of remote work environments and distance learning is also something that'll probably be something that'll be around for quite a while, or at least that option. However, even if we go back to the schools, which again, like I said, hope we do, tech usage and adoption is certainly not going to slow down. There are more devices in the hands of folks. You know, a family of 4 has upwards of 10 devices, anything from their smartphone and Chromebook and TV. So tech adoption is going to only kind of increase as we move forward, especially with the estimates that over 1.2 billion people will use some sort of virtual reality and augmented reality by 2028. And like I said, that's going to put devices 1 inch from our eye, which will be interesting. It's something we're really going to have to address when it comes to our eye health and overall health. And also the intersecting of work and personal life. That is something that has changed a lot in the last year and a half for most of us, if not all of us, and that probably isn't going away. And then also just the increased blue light. Again, devices are beautiful. When we watch the smartphones and we're streaming on our TVs and the like, the pictures are absolutely gorgeous. But again, that does come with a bit of a give and take. So we are very, very focused on the educational part of this. As you can see, we've got probably 27 slides here today. The vast majority of those slides are based on sharing with you, you know, numbers related, data related to screen time, related to blue light, related to best practices. How do you address this? You know, how does it impact us as adults? How does it impact kids? On our Isafe website, we have a tremendous amount of material that you can go and leverage. Everything from, you know, a blue light handbook to how to save your eyes in the digital age, which you see here on the left-hand side. There is a tremendous amount of content. And our partner, United Healthcare, was with us in helping kind of design this and put these guides together. And they are as you know, there's a ton of different options here. You can, if you want, read a couple hundred pages in the case of how to save your eyes in the digital age, or we've got some stuff that are simple bulleted solutions or one-pagers. But feel free to jump on isafe.com and access that content. Again, for us, it's all about education and awareness. That's where we really put a stake in the ground. And then just so this group knows here today, you're able to schedule a free webinar anytime you'd like for your school or your district. We can actually get our eye doctors on the phone, or excuse me, on a call. And so if you've got interest in learning more or scheduling a similar presentation to this for your school or district, please don't hesitate to reach out to me. We can set that up. You can reach out to your Trafera rep to set that up also. And like I said, we have doctors available to answer questions for you. If you have specific questions around, you know, eye health and screen time and blue light, you can either jump on a webinar with us or send me an email directly, and I can get answers from our eye doctors and get them back to you within 48 hours. But don't hesitate to reach out if this is something you want to arrange for your school or district. And so that's it. I'm gonna give you a little bit of time back today. I really want to thank you for sharing 45 minutes or so with me. I want to thank Trafera, our partner. They're really taking the lead on this into the education channel because they know how important this is. Very few accessories that you offer. Matter of fact, I'm not sure, we might be the only one, are truly a health based accessory, and that's what this is. So again, I thank you. You can see my email here, paulw@isafe.com. Please don't hesitate to drop me an email if you have any questions, would like to arrange a follow-up. I'm happy to jump on calls or webinars whenever you'd like. And again, have a great rest of the conference here. Health and happiness to all of you, and thank you for joining me.